Good morning and welcome to Carolina Breast Friends YouTube channel. Today I would like to welcome Emily Hansen, Senior Director of Resensation Program at Axogen. Emily, thank you so much for joining us today.
Thank you so much for having me. I'm excited to talk with everybody about resensation today. I'm gonna share my screen and we'll get this kicked off. And I'm going to go ahead and start it off with a short video animation. I feel like this really does help to set the stage. It's about 2 minutes long, so I'm going to go ahead and play it here, and then I'll move into a deeper portion of the presentation.
A breast cancer diagnosis. The list of questions running through your mind feels never-ending. How did this happen? Will I be okay? Why me? Your top priority is getting rid of cancer, but there's a long-lasting side effect of mastectomy that likely never crossed your mind. Incisions and stitches heal with time, but numbness and lack of sensation can be permanent, a constant reminder of what you've been through. Numbness occurs because the nerves in your chest are cut during a mastectomy when the breast tissue is removed. This means they can no longer send signals to your brain that help you feel things like temperature or touch. It might not seem like a big deal at the time, but women say they weren't prepared for how numb they would feel or the impact on their day-to-day life. Think about numbness after a dental appointment, the awkwardness and overall discomfort. Now imagine that feeling being permanent and covering a large portion of your chest. You may not be able to feel warm water on your chest in the shower or the pressure of a seatbelt to know if it's too tight or loose. You also may not be able to tell if your chest is injured while cooking or doing physical activity. Most of all, the sense of touch is gone, whether it's being able to feel the embrace of a child or a moment of intimacy with your partner. Advancements in treatment give us hope. With resensation, it can be possible to feel closer to normal, to surrender one less thing to cancer. During breast reconstruction, the nerves that were cut during your mastectomy can be reconnected using processed allograft nerve tissue. Over time, the nerve can regenerate to potentially restore feeling and sensation. Numbness doesn't have to be the standard for the rest of your life. Talk to your doctor and care team about resensation. You can hope for more.
All right. So let me go back to that presentation in 1 second. All right. So I hope that was a helpful kind of introduction into post-mastectomy numbness and what the resensation surgical technique is. I think all of us on this call or on this webinar are pretty familiar with the prevalence of breast cancer. We know how many people it affects, being 1 in 8 across the country. And there are almost 4 million survivors living in the United States currently. But a lesser known fact is really the prevalence of patients that are experiencing either pain or numbness or a combination of those two after breast cancer surgery. And what we're really trying to do is raise awareness about this and help people be more informed about their surgical options. When we think about the evolution of breast cancer care, and we think of, how many amazing advances have really taken place even in the past 25 years or so, it's pretty incredible. We really started with aggressively removing the disease with radical mastectomies, removing the entire breast and even portions of the pectoralis muscle. And reconstruction wasn't really an option. Most survivors were really kind of made to feel that they were lucky to be alive. But as we've moved forward, there have been a lot of advancements in opportunities for treatment, including different types of mastectomies, being able to spare some of the skin, and in some cases spare the nipple, and to be able to recreate the breast with both implant type of reconstructions and also autologous tissue reconstructions. But even in that sense, with a lot of the evolution of the cosmetic aspects of breast reconstruction, the actual opportunity for sensation is not always being restored. So when we think about what are sort of the next opportunity, how do we take breast cancer care to the next level? We're thinking about how to have a more complete breast reconstruction and really trying to look at, is there potential to restore sensation, to give patients more of an opportunity, not only to potentially look more normal after surgery, but to also have feeling in their reconstructed breasts. So sensation is important for a couple of reasons, and it can be hard to think about what it's like to lose sensation if you haven't experienced it before. Many of the patients that we've talked to across the country for several years have really shared that it wasn't something that they really felt prepared for. They didn't know what that would mean in terms of an impact on their life in the long term. So sensation does a few things for us. One, it provides a bit of a protection barrier. So when you have sensation in your chest, you're able to feel temperature, avoid injuries that can happen after mastectomy, such as burns with curling irons or heating pads, or even from the sun, for example, and being able to feel temperature changes in the water. It can also impact self-confidence in relationships. You know, having sensation is really how we interact with the world around us. And when that's impacted, it can feel very disorienting. And it can also really serve as kind of a potential barrier to moving on, because in addition to a lot of the scars after surgery, having that numbness be a constant reminder and kind of take you back to the cancer journey on a daily basis. So when we think about why does sensation loss happen, I think it's always important to really start with understanding, just a very high level understanding of what nerves do in our body. So all of us have peripheral nerves that run throughout our body, and they're really how we interact with the world, and they transmit signals back and forth to our brain that help us move our body, move our muscles, and also feel things like temperature, touch, and even pain. And those nerves, they also run through the breast. And so when a mastectomy is performed, you're going to be cutting and removing that breast tissue in order to be oncologically safe. And when that happens, the nerves are removed with that tissue. And so once those nerves are cut, they're no longer transmitting signals back and forth. And that's really why there can be permanent numbness in the chest after mastectomy. So resensation is a surgical technique that can be performed during breast reconstruction. So after nerves are cut during a mastectomy, they can be repaired using a nerve allograft during the reconstruction. And then over time, nerve fibers can regenerate through that graft, and sensation can start to gradually return to the breast. So what is a nerve allograft? This is what we essentially use. You can think of it sort of like an extension cord between the nerves that are cut in the breast and being able to reconnect them together. And a nerve graft is donated tissue. So similar to organ and tissue donation, you know, many of us are organ and tissue donate on our licenses and things like that. You can donate all of your major organs, but you can also donate corneas, skin, and even the nerves. It's pretty incredible. And so our nerves have a lot of structure on the inside that helps provide support. And you can see this zoomed in photo here. Axogen is the company that works in nerve repair, and we have a very rigorous process that helps to clean and remove any of the genetic material from the nerve so that it acts as like a blank scaffold and can be implanted in the body. And then over time, it basically regenerates into your own tissue and nerves as it heals. And it provides a bridge for that nerve to regrow and repair itself. So in terms of who can be an ideal candidate for resensation, At this point, it's if anyone is having a mastectomy and they might have either immediate or delayed breast reconstruction, they may be a candidate for resensation. So this procedure can take place in free flap breast reconstruction, so similar to like a deep flap or a free tram flap, in implant-based breast reconstructions. In some cases, if the initial reconstruction was done with implants and there's going to be a revision to a free flap, it can be performed then. And then also during some aesthetic flat closure procedures, if a person is not interested in having a full breast reconstruction. So of course, any candidacy is going to be based on a patient's kind of medical and surgical status and would require a consultation with a surgeon that's trained in the resensation technique. But there are a lot of options for a lot of people if they're interested in having their sensation repaired. I also think it's important to talk about what is normal after resensation surgery. So nerves are some of the slowest regenerating tissues in our body. And it takes time for them to regrow and heal themselves. In general, it can take up to 2 years for sensation to return, but it can start happening slowly. Sometimes as early as 6 months after surgery, you may feel some little zings and little zaps or kind of tingles throughout the chest. And that's usually a good signal that the nerves are starting to wake up and start to regenerate. So I do think it's important. There's no instant gratification in nerve repair. I wish that it was as easy as waking up after breast reconstruction surgery and having resensation and the nerves working again, but it does take some time in order for them to regrow and heal. We also think it's really important to understand the importance of getting sensation back in the chest. And a couple of years ago, we undertook a market research project. We're able to interview 30 women across the country, half of which did not have any resensation procedure and half that did. We really wanted to understand in their own words, what was it like to lose sensation, potentially regain sensation, and what were their thoughts on this being an opportunity for more people. And it was really rewarding to hear that almost all of the patients that participated in this project, regardless if they had resensation or didn't, really agreed that they felt strongly that advocacy, friends and family should at least be able to explore options if they'd be interested. The potential that the procedure may or may not work kind of outweighed the risk of it not working because the situation would be the same as if the procedure didn't take place. And those that did have sensation back after having the procedure really felt that it was more of a game changer in order to give them back a sense of normalcy, and really believe that this should kind of move forward to become more of a standard of care in breast reconstruction. So as part of the resensation team and some of the work that my team and I do, we're really focused on the power of education, really trying to help more people understand what happens during a mastectomy, what nerves do, what options may be available. And so we focus on surgeon education, not only plastic surgeons, but also breast oncologic surgeons who perform mastectomies to try and improve their awareness. And also try to be able to reach patients directly, just so that they have more opportunities to be informed and have discussions with their care team. We do have some frequently asked questions, and I'll cover a couple of these before we turn the presentation over to any other Q&A that may exist. But I always think it's important to address a few of these that are pretty common. Many of them questions will be along the lines of, if someone has already had a breast reconstruction, could this be an option after the fact? Resensation does have to be performed at the time of breast reconstruction, but there are some situations where if somebody had a primary implant-based reconstruction and they were planning to revise that procedure, either to change out implants or switch to an autologous reconstruction where it may be possible to perform resensation. We do get questions about patients who want to go flat. And that can be possible as well, especially for patients that are going to have an immediate closure after a nipple-sparing mastectomy. We do get questions around insurance coverage, and breast reconstruction is covered by insurance most broadly across the US, but breast neurotization does vary by insurer. And so all of the surgeons that we work with, they are trained to work directly with their patients to pre-authorize the procedure before any surgery is done to see if particular insurance policies will cover it. And then we get questions too about how long the procedure will take, because you're going to be under anesthesia during breast reconstruction, and there can be concerns about that. And all of the surgeons that we work with really report to us that the procedure adds minimal time to the overall procedure, usually because it's happening at the same time as other parts of the reconstruction. But in general, it can add about 30 minutes to an hour to the procedure, just to give a little bit of perspective to be able to repair the nerve tissue. So I will stop the presentation here.